Good afternoon and welcome to First Alarm Family First. My name is Carolyn Acosta.
And I'm Jen Herrera. Once again, we are very excited to be here. It's kind of nice, Carolyn, to sit down.
I know.
Relax. I'm not going to lie, especially after the past 4 or 5 days that we've had. Have you recovered?
Kind of. I mean, this past weekend was incredible. We had so much love and support for First Alarm. We had the opportunity to be at the Miramar Benevolent Golf Tournament, which was amazing. First Alarm had a table there, and they actually said that next year they would First Alarm would be their main focus.
Love that.
That was awesome. Yeah. The day was great. My son went with me, and this was one of the first events that he actually was a part of, and he had a great time. Yeah. Really, it was really nice to see all the support there.
And he took part in so many events this week because he was also, so you were there in Miramar on Thursday day, and then Thursday night we went to First Responder Night for the Panthers game.
Yes. And that was awesome too. They had a great turnout there. Damian Valdez was the group coordinator for the Panthers arena, and he did such a phenomenal job. He's also a veteran, and this was very dear to his heart too, so he definitely helped out with that. But what a great night to just cheer on the Panthers and then wear our First Alarm swag. Yeah. It was awesome.
No, it was so fun. It was for all of us to kind of get out. It was the first time all of our kids were hanging out, which was really neat. My husband was there, so he saw a bunch of firefighter friends there. And then I saw so many people
who my dad worked with that I've known since I was a little girl. So that was really neat too. Just the generations of first responders who were out there from Miami-Dade Fire Rescue. And of course there were first responders there from so many, and the place was packed.
It was packed. It was honestly a great night. Yeah. It was a great night. Even though it was a Thursday night and we had to get up the next day for school.
I'm not used to that anymore. That quick turnaround.
At all. Even the kids were having a hard time the next day getting up. But you know what? It was all worth it. It really was. I'm glad that they do that. Yeah. You know,
the response
so next year will be
amazing.
Great.
Yeah, it was entertaining too. There were a lot of fights.
That there was. Yes. Yes.
And then Saturday was the big day.
Yes, that was the big day. We were at the biggest pig roast competition here. First Alarm had a table there as well. I wanted to thank a couple people because without them we wouldn't have been there. Luis Fonseca, Kiko, and Michelle Hernandez, because they really helped us a lot with getting us there and just bringing more awareness to this cause.
No, they were incredible. And if you're not familiar with the pig roast, this was the 3rd annual event that they've held. You have police and fire departments from across South Florida competing on who makes the best lechon. So it's like Noche Buena on steroids, you guys. Yes. 130 teams participated in this event. And then you had families and friends. And we got there at 7 o'clock in the morning. We didn't leave until almost 6 o'clock at night out at Tropical Park.
Yes.
And Tropical Park was an amazing host as well. And I don't know, you tell me, there was just this incredible vibe out there. Everybody was having fun. There was music, there were cigars, there was dominoes. It was incredibly South Florida. And then just knowing where the proceeds were going to the Love Fund and who it's intended to help, that vibe, that feeling, it's indescribable to be out there knowing that.
Yeah, absolutely. Just like the community, right? Everybody comes together. Everyone's having a great time. One would outdo the other. I mean, I even saw, I think it was Hialeah Gardens had a actual old patrol car, and they were doing a kahachina in the trunk of the car.
Right.
It was amazing.
Really fun too, because a lot of the times you see or hear about police officers and firefighters kind of like, joking with each other. Oh, who has the harder job? Okay, well, who's going to save you? Okay, well, who's going to, whatever. It's all in jest, and it was just really neat to see that camaraderie.
It was awesome. The PBA did an amazing job. They really did. And, we backed the blue and we backed the red.
I backed the red. How was the lechon? Because I didn't try it.
Oh, it was good.
Was it good?
I had so much lechon. But I do have to say, my husband, Alex, made the best lechon. Yeah. He really, truly did.
You've said that before.
Yeah. If he would have been there, I think he would have won.
Well, I loved seeing everybody walk up to our tent, and you had the big banner and you had Alex's picture up, and people were asking questions who didn't know. And then the response that you received and the genuine hugs, Carolyn, that you were given by people who were just so touched that you were there. That's got to, it has to be an amazing support system that maybe you don't always realize is there, but then when you're among your first responder extended family, it's a reminder.
Yeah, it's a reminder, and it also just shows me that I'm on the right path. I feel like it's something that does need to be spoken about. Mental health is something that we all deal with, you know, some more than others, and I feel like it's just not spoken of. You know, we have to try to break that stigma, you know. We're all in it together, you know, and that's what this is about. You know, just helping others.
Well, again, thank you guys for having us, for everyone who participated to benefit the Love Fund. We felt the love,
yes,
for sure. And obviously the Love Fund benefiting the families of fallen first responders felt it as well. We're excited because today we have a very special guest.
Yes, today I'm excited to introduce Dr. Adrian Mesa. He is a veteran, he is a mental health expert, and he is also the CEO of AMP Mental Health. And we're really excited today to talk about some mental health, wellness, all the things.
Thank you
Welcome.
thank you so much for having me.
So Carolyn sent me your information and she's like, I think I want to have
Him on the show. What do you think? And so I was
a little stalker on the IG. And I'm like, yes, he is totally the vibe of what we are trying to do. You're doing things a little different, not so traditional when it comes to mental health and when it comes to helping others. Can you let everyone watching know why you decided to do it differently?
Well, I mean, mental health is near and dear to my heart. I told you guys off camera, my uncle suffered from mental illness, and I knew what a Baker Act or an involuntary hospitalization was from a very young age. So it affected me, my family. I remember my grandmother, my mom scrambling to get a court order to either have him taken or an ex parte order. And so I was very involved with mental health and mental illness, like I said, from 6 or 7 years of age. And so my Uncle Leo, let me just tell you guys who my Uncle Leo is to me. And I used to get emotional and crack up when, you know, just telling the story. But my Uncle Leo was my mentor, my father figure. And my dad's very much present in my life, but my dad's always been that working man, that hard-nosed guy who's always at work. And my Uncle Leo showed me what sports were. My uncle was also an EMT, but then he suffered from schizophrenia. And as a result, it definitely took his life down a path that I don't think anyone was ready for. And he wasn't properly prepared for that experience. He never was sent to therapy. It was just like medicate, treat, and then sent back home. And I often tell the story, my dog Bruno just passed away recently. My dog Bruno gets a skin infection. I take him to Banfield, he gets treated. A day or two later, somebody from Banfield calls me and says, hey, how's Bruno doing? My uncle gets hospitalized, he gets sent home, and there's usually no follow-up.
Right.
And I saw this again and again throughout my career, and so I wanted to make sure that I could provide the treatment that my uncle never received. Now, thank God, he's doing well, he's stable.
Good.
He's still happily married. God bless your soul, Betty. You've taken great care of Leo. So yeah, it's very near and dear to my heart.
Personal.
Extremely personal.
That's amazing. Can you share a bit about your background as far as in mental health? How did you get to this point?
Yeah, well, like I said, it was a result of my Uncle Leo. And I reached a point in my career where I wasn't sure which way to turn. I wanted to go back to school for exercise science. I told you I dabbled into EMT. And then finally I said, why am I running from this? Why am I running away from mental health? And at that point in time, there was a moratorium. There was no program in South Florida that taught a postmaster's program in psychiatry. And so once the FIU program opened back up, I was the first one who signed up. And I dove right in. Prior to that, I worked everywhere from inpatient psychiatric settings like Aventura Hospital, where I worked in the psych ward, and I saw patients who were coming off of drugs, off of benzos that were prescribed sometimes. I saw people coming off of opioids. I saw people having psychotic breaks, young ladies with who were Baker acted after, let's say, breaking up with a boyfriend and ingesting medications. There was so much exposure I received during those stays that it opened my eyes, and I just wanted to keep going. So then I pursued my postmasters. I worked at Camilla's house as my first job, where I worked directly in the street with the homeless population. And then I've worked nursing home. I mean, I've worked in every sector in mental health, definitely. And I've served just about every population, from the homeless person to somebody who is just to fire rescue, first responders, accountants, nurses, everybody suffers from mental health issues.
It's clear that you're passionate about this, and why you kind of kept getting pulled, right? Almost like a magnet pulled into the mental health field. You mentioned your dad was, the worker, and your uncle had a huge influence. How much because mental health is a stigma in itself, right?
Of course.
And I'm going to say I'm Cuban, so I don't want to get an email. Mental health among Hispanic families, sometimes there's even more of a stigma, and not just Hispanic families, but certain cultures, there's more of a stigma. Not so much now, but a decade ago. How much did that play a role, do you think, in how your uncle's treatment went early on?
Oh, absolutely. I just think that there was the stigma definitely is prominent. There was no such thing as seeking mental health care. Right. It was more so, hey, let's pray about it. Or if you would tell somebody you're going to go see a mental health professional, it still happens to me to this day, where I go to a networking event and I say, I work in mental health. Either the person is offended when I hand them a card, or they say, oh, you work with those people.
Right.
And I think I used to be a little bit more aggressive in my response.
Yeah.
But now I'm just like, well, actually, and I let them know, hey, the average patient that I see is 20 to 50 years old. They have commercial insurance plans. They are working individuals with families and loved ones who care about them, and they're just looking for ways to better their lives. So I feel that stigma is still extremely prominent. And so, yeah, it's just very, very difficult to break it, to allow people to really get the care that they need. Like when you mentioned therapy, seeking therapy to somebody, they're like, oh, I don't need to see a therapist. And it's like, wait, but you guys go to 4, 6, or 8 years of schooling to study a subject that sometimes you don't even go into that career or profession, but you won't take 8, 10, or 12 weeks to study yourself, your behaviors, the impact that your family has had on you. Maladaptive behaviors or dysfunctional ways of responding or coping with different stressors that you encounter. It's like, come on, guys, let's wake up. Like, this is affecting each and every one of us, whether you like it or not. And it doesn't have to be that you are suffering to seek mental health treatment. It might just be you're having some communication issues with your loved one. You don't know how to talk about it. Or it becomes a rift and a big point of friction that just ends up blowing up, and you guys never get to that point where you're actually solving this issue. You dismiss it, you sweep it under the carpet, and you expect for it to disappear. But when it resurfaces, it comes back uglier and stronger every time. So why aren't we addressing the gorilla in the room? Sorry, I could.
No, it's true. That's why we have you here.
Yeah.
For PTSD and stress management, since what would you say are the signs that you should look out, or burnout? Like what would you say are things that maybe you should think about, and maybe think, okay, if I'm going through these things, I should start seeking help, or even before? What would be some of those things that you think?
Yeah, just somebody who's, there's the typical signs, right? There's the nightmares, there's the flashbacks, there's the high stress and irritability. Those are present, but that's a little bit more. Like, let's look before those things happen.
Right.
When individuals begin to disconnect, when they don't want to talk, when they shut down, when you do start to see that behavioral change, when you say, hey, you're acting a little bit different. And I heard previous episodes where you guys both mentioned just not talking about it, or that individual feeling like they have to protect you guys. I will say this to the fire rescue and first responders out there. They don't need protection. They can take it. They're with you, and they understand what it is that you're experiencing and going through. So they are there for you, and they love you unconditionally. So you have to be there for them and expose some of those things that you think you're protecting them from. And it's okay. Yeah. It's okay.
I think that's hugely important.
Very important.
To give that reminder. And, whether you're a spouse or a mother or a father, you sign up for that. Yeah. Right? When you commit to your family, you sign up to make that commitment, through all of it. You have experienced a lot, and I think this is important because we've talked a lot about first responders specifically not wanting to just talk to anybody. The term culturally competent comes up a lot as far as, and this is not against someone who may not be culturally competent in this field, but it does tend to make a difference for one reason or another. You are a veteran. You served. You also have been deployed. 2010, one of the worst earthquakes ever struck Haiti. I remember being a reporter at the time, and some of my colleagues coming back and telling me what they saw. Nobody should see those things, but people have to see those things when they go to help. When you were, let's take Haiti, for instance, when you were there on the ground in 2010, at that moment, did you realize these first responders are going to need help after seeing what we are all seeing right now? I was somewhat blind to it. In fact, throughout my career, I was blind to it until I realized in retrospect that I had some symptoms of PTSD from working in pediatric ICU and what I was exposed to. And I was having the nightmares, and I was having the flashbacks. And I was the overly concerned parent when my daughter was born, saying she's going to get hit by a car, having nightmares of her getting hit by a car.
And so I didn't realize it. And even I hear you guys speaking about first responders, and I want to throw nurses in that pack too, because
Absolutely.
they're constantly
100%.
nurses who work in Ryder Trauma Center, or like I did in Jackson in the pediatric ICU, or those environments where we're constantly exposed to trauma. There is no debriefing. There is no counseling center for these group of individuals. Why? Why?
How do you deal with this? How do you manage it? Like, so what are some tips that you would give to say, you know, when you go through all this, what do you do? Do you work out? Like, what is it that you would recommend?
Yeah, I think there's those foundational things that we all need, which is exercise, sunlight, sleep, gentlemen, sleep. Sleep is essential in the field of fire rescue, and if you're working the graveyard shift, that's severely impacted. Social connection, huge. And so many men have trouble with that. I feel like women have these outings where they can get together and they just, oh, we're having a ladies' night, and you see all these girls getting together. Oftentimes guys don't have those nights. They don't have that group of friends that they could just go and hang out with and be vulnerable and be real.
Right.
And so I think that you have to keep in mind all those different things. So coping is not only just exercising, it's going to be socialization, it's going to be communicating. It's huge. It's huge to communicate.
What advice do you give? Because you just hit on something that I think is very interesting, how you were overly concerned during the birth of your daughter, right? Because people who are in the medical field or who are first responders, you guys have seen everything that could possibly go wrong. I had dinner with my parents last night, and they were telling me that they wanted to buy me a Garmin because I run, and that they're nervous that something's going to happen to me. My dad's retired fire rescue, or, you know, God forbid I got hit by a car. I'm like, I have my Apple Watch. I don't need a Garmin. I'm okay. Yeah. But all jokes aside, it comes from the right place. It comes from individuals who have been exposed and have seen the worst. So what is your advice to first responders who have seen the worst and being able to kind of let go a little bit and not always go to the negative or the worst possible case scenario?
Therapy. It's going to be therapy, because I think we catastrophize, right? We tend to jump to that worst case. We jump to that worst case scenario over and over because of our exposure to different things. I could have sworn my daughter was going to have a cardiac anomaly, some sort of cardiac issue, because of the amount of newborn babies I saw that were born with all these just congenital defects in their heart. And so all I wanted was an ultrasound of her heart, and I remember that vividly. And once I heard the heart beating and everything was working well, I was like, okay, it's like a big sigh of relief, but it's kind of bizarre when you think about it. And same thing with having nightmares down the road. Why am I having these nightmares? And nobody ever directed me towards any form of therapy or any form of help. It just is something that was just part of the job.
Yeah.
How do you think families of first responders can better support their loved ones?
I think even though your partner doesn't want to go to therapy, you taking the first step to go, because you have to learn how to deal with those swings of emotions and how to communicate with them, and how to bring up topics that might be sensitive, and learn how to navigate your own responses. Because you might approach someone and kind of confront them about their behavior or what they're doing. Right. They snap back at you, and you're like a rubber band who snaps back at them, right? Because now it's a tug of war over this thing where you were actually trying to provide help and support. Right. So recognizing our own reactions to their irritability, anger, frustration, or isolation is extremely important. And I heard you guys say it before also, which is go with them.
Yes.
Go with them. Yeah. Right? Just say, hey, something's not right. I made an appointment for both of us. There's nothing wrong between you and I. This is for us. This is for our family. And so I think the way that you deliver that message, as opposed to you need to go to therapy, you need treatment, you need help. Now it's an attack on them, their persona, their ego.
Right. You're the broken one.
What's going to happen? Defenses are going to go up right away. They're going to want to fight, not physically, but emotionally. They're going to shut down. They're going to just dismiss you. And now they're going to really stand their ground and say, no, I'm not going. Yeah.
It's the you versus the we, right? Let's make it a we. Let's not make it a you. In your experience dealing with first responders, are they reluctant when they first sit down in your office? I mean, do you even sit down in your office? I know your office is very unconventional. Is there a couch? Is it like unconventional?
Yeah, they sit down. Honestly, I'll be honest with you. Right now, I'm not seeing patients. I got to a point where I realized I am not best serving these individuals by me seeing them.
Mhm.
So I have built a team of providers to see them. Because I also realized that after almost 15 years that it was affecting me.
Yeah.
Right.
So I had to have enough insight and self-awareness to say, okay, I'm not the man that can only take care of these individuals.
Yeah.
I need to build a team around me who can really help them as well. And I've done that. Tell me your question.
No, that's okay. The first responders, are they, and I think this is important to highlight, and we often do.
Yeah.
There's different generations, right, of first responders, and I do like to think that the younger generation coming in is much more open to it. I might be wrong, but I feel like what we've learned so far on this journey, they are. But perhaps some of the older ones, is there a reluctance when they come in? And I know even if you're not seeing them among your practice.
I think it depends on the situation or scenario that they're coming in with. Sometimes if they're mandated by their you know, if they have orders to go by the department to say, hey, you must go get treatment somewhere, it's very different when somebody comes to the realization on their own, like, I think I need help. Like, I think something is going on internally and I am struggling and I'm coming for help. So I think it really depends on the individual and the reason that they're coming to the office.
You mentioned you have a daughter. I
Yes.
know that she watched our show with you.
Yeah.
We have teenagers, the two of us as well. How much of an impact does it have having these conversations, these very open, honest conversations, listening to shows like ours?
Absolutely.
Especially in these teenage years. How important is that?
I think it was so interesting because she has her Spotify playlist ready to go.
Oh, gosh.
Because right now she's driving to school, you know, and I'm just the passenger in the Uber.
Are you like this?
No. Well, this morning there was a little incident, but we cleared it up and we discussed it. But
I like how you say you discuss it. Of course, you're there. It's not like,
What are you doing? Hit the
no,
brake.
I was like, well, how was that? What was that experience like for you?
Oh, you're like,
Yeah. What could you have done differently? But it's amazing. I think I had 3 messages after I posted that today asking, how do I start this conversation with my child? And I said, listen to a podcast about mental health. Because just let them listen to it, sit with them, just like that in a car ride. You can just put it on. Don't even say anything. You don't have to say anything. And then when something comes up and you want to make a comment, just pause it and say, hey, what do you think about that? This is how I feel about it. What do you feel about it?
Yeah.
Okay, cool. Let's just keep playing it. And you hit play again. It doesn't have to be this whole dissertation that you're giving them or delivering to them, because I'm guilty of lecturing. You know, you go on these rants.
These tirades.
Yeah. But just playing it for her and listening, she got engaged immediately. And I told her, oh, I'm going to be on this podcast today. Like, this is extremely important. I want you to listen. Boom. And as we're listening, a question comes up. Yeah. You know, oh, what school does their son go to? And like, oh, wow, that's really difficult. Or, you know, like, oh, my friend has struggled with this before. And so that just opens up those floodgates of a conversation where there's no judgment. She can be vulnerable, and all you're doing is listening. And as parents, we struggle to listen sometimes. Yeah, we need to let them talk.
It's true. Yeah, because we're all going through the same thing, young or old, right? Yeah. And I think that they need to know that it's okay not to be okay, because we're always trying to keep everything together, you know. But you know, at the end of the day, it's like, I don't even know what I'm doing. Exactly. You know what I mean? Exactly. And it's okay not to know. But let's talk about it. You know, maybe you can help me, because they can help us too. So it's I love the fact that, you know, everyone's talking about it. We have to break this stigma, because you're not alone. You're not alone out there. We're all going through our struggles. And
I love what you just said, that we have no idea what we're doing.
Nobody has.
And so I would tell my daughter from the beginning, Eva, I'm going to make mistakes. I'm not perfect. I'm going to screw up big time. And if you catch me screwing up, you can point it out to me. Yeah. And if I need to say I'm sorry to you, parents, you could say I'm sorry to your child. There is nothing wrong with that, because you're showing them a behavior that they eventually have to take accountability for their own actions. And if you're always defensive over mistakes that you make, guess what they're going to do? Right. They're going to become extremely defensive as well. Yeah. These are all learned behaviors.
Yeah, that's great advice. We're kind of winging it, guys. We're figuring it out. You mentioned sleep, you mentioned sunlight, but I know fitness is a huge part of your routine personally.
Absolutely.
As far as, you know, staying in a good place. Carolyn and I are both huge advocates when it comes to fitness. It's been transformative for you.
Absolutely. I mean, I've engaged in some form of exercise my entire life. Yes. Actually, this is a good topic to bring up, especially for the men who are listening. About 1.5 years ago, I was feeling down and out. I was still going to the gym. I was still exercising. And I just said, I think I'm depressed. Something isn't right. I don't feel good. My energy is low. I didn't want to bring out, today was garbage day. I didn't want to bring the garbage bin out.
Right.
It just felt like this task that was insurmountable, but I would do it. I would drag myself to do it. I got blood work. My testosterone was like in the 200s. And I didn't realize it. And right now, a lot of the foods, like the hormonal issues that we're seeing amongst men and women right now because of the foods that we consume, like we need to become more aware. So I tell all patients and my providers that work with me, we need to look at the biological level first.
Yeah.
If somebody all of a sudden is coming in with all these different issues, we need blood work.
Blood work,
Is there anemia? Is there a thyroid issue? What else is going on underneath the surface before we jump to an SSRI? Therapy, I think everybody could benefit from, but when we start treating symptoms without knowing what else is going on, we got to question what we're doing.
I love
that.
this.
That's so
I
important.
love that you brought this up because the medications are handed out, but what is going on? What's going on in Carolyn's body is not necessarily what's going on in my
Completely
body.
different.
We can be two women the same exact age,
But we're going to give you both Prozac
right?
to feel better.
Right.
Right.
A little Band-Aid, but it
Literally what's
doesn't
happening
cure whatever. Yeah.
is
it's
completely
inside.
different.
Let me not dismiss medications. There is
No,
there
absolutely
is a
not.
place for medications.
Absolutely
They are necessary. They if you are having a quality of life issue that we need to treat temporarily while we align everything else, perfect. If you are having severe panic attacks, not sleeping well, we can help you. But let's look at the underlying cause, right? It's root cause medicine. It's not just throw a Band-Aid on an ulcer because the ulcer's still there. You're just covering it.
Yeah. It's not a one size fits all
At all.
either.
Absolutely not. Everyone's different. Yeah.
And that's but the problem. I don't want to get into this, but
Get
No, please get into it. Yeah.
it's just managed care. It's what your insurance provides. It's what your insurance dictates that the provider can do. So sometimes when people have to start coming out of their own pocket to find out a little bit more information, people become extremely reluctant because they feel like, oh, why isn't my insurance paying for this? It just isn't, guys. This is just the system is somewhat broken, but it's okay. We'll still work with you. We'll try to help you as best we can, and make it as affordable as we possibly can.
Resource wise, do you have advice for somebody who's watching right now who likes what you're saying and everything that you're saying? Where should they go? Do you have certain websites or people on social media who you follow, who you recommend?
I do. If I started naming people, I don't want to be biased here, but you can feel free to reach out to me directly and I'll be happy to listen to my DMs are this. My DMs are a triage of just people going through different issues and trying to figure out which way do I go. And honestly, when you call my office you call the front office, if we don't accept your insurance and you need help, I've made it so that it's a hub that we just refer you to another provider who's in our area.
That's great.
Who can help you as opposed to just leaving you on a waiting list or just sending you into the abyss because it doesn't make sense. The system is extremely difficult to navigate for somebody who doesn't know.
And I think when they're at that point too, they're so frustrated already that it's almost like when you're reaching out, and if it took you so long to reach out and you hit like a wall,
That's it. You give up.
That's it. You give up. Yeah.
And that's extremely common.
Yeah.
Remind everybody where to find you.
You can find me at Dr. Adrian Mesa. That's Dr.Adrian_Mesa or at AMP Mental Health. That's Alpha Mike Papa Mental Health.
Or AMP. Like amplify.
Yeah, there you go.
Come up with a whole bunch of reasons for that. You have to check out the website because it's very Miami and that was intentional.
Yes, it was.
Yes, vibrant neon colors.
Yes. I love it. Love that Miami Vice feel.
I just want to thank both of you guys. This has been extremely
great.
awesome.
Dr. Mesa,
I love what you guys are doing.
And I love what you're doing.
Thank
so
you.
I think that, I think that we work together like this, break that stigma, more people will feel free. And I think that, listen, having something is not out of the norm.
Yeah.
We got to make it a cool thing.
Absolutely.
I mean,
yeah, exactly. It has to be attractive to especially the younger crowd who really needs it.
Yes.
The cool kids are going to therapy, guys.
They really are. I mean, they really are.
If my daughter would only post it on social media.
I'll try. Maybe I can get one of mine to share. Thank you.
No, thank you guys.
So
I
much
appreciate
for
it.
being here. And a couple of more thank yous before we go. We want to thank Lowercase Law. They have been extremely generous to the First Alarm Foundation and First Alarm Family First. And as always, the community newspaper. We want to thank you guys for hosting us as well. This is episode 5.
I know. I can't believe it.
So many more to go.
Yes.
Yeah.
Yes.
And as we get closer to the holidays, we, of course, want to wish everybody well and know that we're thinking about you and know that there is help out there.
Yes.
Absolutely.
And
Sound the alarm.
sound the alarm. Save a life.
Till next time, guys.